We are at an age of unprecedented medical innovations. And so for clinicians and radiologists, it means more information coming from more places, creating a pretty hectic environment. Enterprise imaging comes to cut the noise and eliminate disruptions, allowing clinicians and radiologists to focus on their primary role, which is diagnosis, and make technology an extension of their thought process. That's life in flow.
In the past, there was just X-ray, and you'd get a scan, maybe one or two images. In the 70s came CT, in the 80s MR, and there were more images. But as those modalities move forward, now they're really proliferating a ton of images. Every department has their own solution to track images. The problem with that is it puts all the burden on the healthcare provider. So they're the ones who have to go out and discover if there are historicals, and if they are, bring them all together. And very often where they might be, they're not accessible. And if they are accessible, they're not accessible fast. Obviously, we can't just hope the problem away, right? We need to do something about it. And that's where we come in.
AGFA HealthCare helps hospitals and health systems eliminate complexity from managing multiple redundant systems across their ecosystem. We are transforming the delivery of care, providing efficiency with quality, supporting healthcare professionals across the globe regardless of borders, time zones, and service line. Our flagship enterprise imaging platform creates an imaging patient record, which comes to align and complete the hospital electronic health records.
The importance of the concept of an imaging health record is for the entire treatment life cycle of a patient. And we can argue that in many cases, the radiologist is the center of that universe. For lots of conditions, there are lots of other types of physicians and medical imaging that are required. And ultimately, having a single pool where every consulting or physician that has to make a decision has instant access to that information, it allows them to make more educated and more timely treatment decisions for their patients without having to go through the trouble of finding the data that's in this system or that system.
They're also able to share work lists between different sites so that we can, have multiple radiologists that can work with their specialty. You obviously do your best work when you're doing what you're best at. And so you can have the best work for that radiologist delivered right to them and have a customized work list that allows them to do that. What's actually most important about it is it also is better for the patient, because not only is it taking away work for the healthcare provider, but of course there's a risk if there's an important prior image from some department that a physician doesn't know about when they're treating you. And it puts it all in one place for easy access so that you can get the right treatment at the right time.
In the United States in particular, there has been a trend towards health systems getting larger. And the CIOs are tasked by their boards to help facilitate the assimilation of organizations or mergers between organizations. And that brings additional levels of complexity.
Our system allows you, as a healthcare system that might be now absorbing a new hospital, to very quickly, without changing much of the underlying technology that the health system has that's being purchased, to be incorporated into our solution, and really from day one to get them on and being able to share that radiology workload.
That's one of the areas that we really try to focus with at AGFA, is to give them these tools where they have a routine or a standard way of doing this that's low cost and very easy to implement, so that each merger and acquisition can be done in kind of a standardized way. Future medical imaging systems have to support wide area networks. And this is the active path that AGFA is on. Our goal is to be able to provide actual performant imaging systems even halfway across a country, inside of an entire province. In the future, PAC systems, medical imaging systems, enterprise imaging systems, have to scale. And they have to scale to very, very large organizations over large geographic areas.
We are focused on responding and remaining at the forefront of imaging, innovating, and development for our customers. Our purpose is to remain in a position where we can respond and deliver on our customer needs.